first of all, the prostate is a small gland which sits under the bladder and is responsible for producing liquid that combines with sperm. Prostate enlargement is a benign, i.e. non-cancerous growth, which is a medical condition which is very common as men get older. Enlargement of the prostate doesn't necessarily cause signs or symptoms, and the size of the prostate isn't always proportionate to the symptoms that men may suffer. Typically, as men get older, particularly from the age of 50 onwards, approximately half of men may start to notice some urinary symptoms. And in fact, those men over the age of 80, almost 90% of men may have these symptoms. The most common symptoms men may notice is that their urinary flow may slow down. They might find that they're going to the toilet more frequently. They may get up in the night to pass urine. And also they may find it difficult to start their stream or find that they do have some dribbling at the end of the stream. These are the earliest symptoms that men may notice. As symptoms progress, ultimately there may be an impact on the ability to empty the bladder properly. And this can increase the risk of developing urinary tract infections, bladder stones, or even possibly going into a condition called urinary retention, where men find it difficult to pass urine. We don't truly understand the cause of benign prostate enlargement, but we do know that it's associated with increasing age, can be associated with a family history. It's influenced by the male hormone testosterone. So the older men get, the more likely they are to develop a benign enlarged prostate. And there are other conditions which can be associated with prostate enlargement, such as obesity and diabetes, and also heart disease. There are a number of lifestyle modifications that patients can adopt. It depends very much on the symptoms they're suffering from, but for example, if patients are finding they're getting up more at night, they can reduce the intake of fluids during the evening. If the symptoms are more problematic during the daytime, then we often advise patients to minimize the intake of bladder irritants such as caffeinated drinks, fizzy drinks, etc. And also be aware that constipation can cause an increase in urinary symptoms, so avoiding constipation is important. There are also some medications which may affect bladder function, such as antidepressants, antihistamines, and also water tablets or diuretics. So when patients are on this medication, it's important that they are aware of these potential side effects. So for patients who have severe symptoms or are in urinary retention, or perhaps don't wish to consider ongoing medical therapy, there are a number of surgical options. And more recently, a number of newer options have become available. It's important to realize that nowadays, the treatments are very much tailored to the individual. We have to assess and prioritize functional outcomes, such as sexual function and continence, when considering what option may be most appropriate for each individual. So there are a wide variety of minimally invasive options, ranging from treatments designed just to treat bladder neck obstruction, such as an ITIND procedure. For those who have an enlarged benign prostate, may wish to consider a steam treatment of the prostate called Resume, or a urolift procedure. These are day case operations with few side effects, and can be carried out almost in an outpatient setting and under local anaesthetic, ranging to more invasive options for larger prostates or patients who want a more definitive option, such as a laser prostatectomy, where the inside core of the prostate is removed. A more traditional procedure called a transurethral resection of the prostate, or newer procedures such as something called aquablation, where water jets are used to remove the inside of the tissue which is obstructing the water flow. So it's important that patients are aware of all their options, and that the urologist assesses each individual patient to determine which of these may or may not be appropriate for each individual.